fellowship-trained breast surgical oncologist. I'm Dr. Amani Jambakar in Santa Fe, New Mexico, and recently I posted a couple of videos about lobular breast cancer. One of the comments I got in response was, I had the same type of cancer, a lobular breast cancer. It was about 1.4 centimeters, no lymph node involvement. I had a lumpectomy radiation and was on letrozole for 5 years. I'm extremely healthy and had breastfed, had no genetic risk, was double mastectomy recommended. I was 72 at the time. This is a question I get in the office all the time. Lobular breast cancer does increase the risk of another cancer in the same breast or in the other breast. This is an MRI of a lobular breast cancer. The arrows depict that it involves the nipple and a pretty extensive area in this woman's breast. But the other side has a lot of gray stuff in there, and that's what we call background enhancement. Some people with lobular breast cancers have small tumors and they can get away with a lumpectomy. But this patient, you can see with how much of her breast it's involving, she unfortunately would require a mastectomy. But the other breast would still need an MRI in 6 months. So when I'm counseling my patients about whether or not they should choose a double mastectomy just because they've been diagnosed with a lobular breast cancer, I do ask them if they would be willing to get an MRI in 6 months and probably do an MRI yearly after that, as well as a mammogram yearly. And if they're okay with that and they're okay with the possibility of additional biopsies, then I think it's okay not to choose a double mastectomy for a lobular breast cancer. But especially for those who are diagnosed in their 70s, statistically are less likely to get another breast cancer in the other breast or in another part of that breast. So the answer is you make the decision that's right for you. If you were counseled about needing MRIs going forward, and you're okay with that, then it's okay to have the least invasive surgery for a lobular breast cancer. But if you don't want to get MRIs going forward and you're worried about getting future biopsies, then it's worth considering removing both breasts.